how do you do it? I mean, literally, how do you transport the vaccine and maintain the correct temperature during that 3-hour drive?
Well, the vaccine is removed from the ultra cold freezer, and our pharmacy staff, which is excellent in preparation, puts the vaccine into the cooler, which I have behind me, and that cooler is monitored for temperature. So it's monitored from 3 to 6 degrees centigrade all along the way, and we monitor that and make sure it stays at that temperature all during the trip up there.
And what about the details of the refrigeration? Is there a period of time in the transport where the temperature doesn't have to be as ultra cold as it might have to be for longer term storage?
Yeah, as soon as it's removed from the freezer, it usually takes about 2 hours for it to thaw, and it can thaw from that ultra cold state while it's in the carrying freezer that I transported in. So then once it's received by our staff, our pharmacy staff in Alpena, then they place it in the refrigerator there, and it is good at that temperature for only 5 days.
Why you, doctor? There must be other ways to get this vaccine from Midland up 3 hours north up to Alpena. Why did you take on this duty yourself?
Well, we've had a very good and active group of my colleagues who've been working on the planning of this dispersal of the vaccine. I happen to still have a home in Alpena. I spent all of my clinical career as an obstetrician gynecologist in Alpena. So part of my coverage for the region also is Alpena and West Branch of Gladwin. So I have still maintained close ties to that community.
I have to believe when you're living in a place like Alpena and you hear, well, the vaccine is here, it's arrived, and there's a lot of different Alpenas all around the country, remote locations. I have to believe people are just thinking, well, it's not going to get here for a long time. So what was the reaction when you showed up with that delivery of vaccine?
Well, I mean, we were timing when I left and when the group to receive the vaccine was going to be assembled and everybody ready to receive it. So that was kind of neat to be kind of in phone contact where I was along the way so they could be ready. You know, the experience in the room when we walked in with the vaccine, what was I can't describe it. People were there was tears when people were receiving their injection. People were clapping. Nurses and physicians, just the joy was really palpable. It was something.
It sounds like the joy and the clapping that accompanies delivering babies, as you did for so many years.
You know, it really, it's the only thing I could compare it to, honestly. Is delivering a child and handing that baby off to parents that have been hoping and dreaming and thinking about this baby for the last 9 months, and then to finally see it and hold that baby in their arms, and for me to be able to give that, be part of that experience. It was a privilege for the years that I was able to do that for the community in Alpena, and just to see that very similar thing happening all over again, because this has been a long pandemic, and the staff, the clinicians, the nursing staff, whatever, et cetera, you know, just hope was what we delivered, I think.